on its civilians. And what exactly is PGD? Vitro fertilization have selected out their embryos, and they are testing these embryos for certain types of characteristics out disease. And this is the reason why some people compare it to eugenics. They say this is a weeding out of the disease. Well, why is it an important use of these practices, such as in Thailand, where baby Gabby just a couple years ago was abandoned by the people who were the intended parents? So is selection of embryos, testing out embryos, a bad thing, right? And it really depends. Let's think about it within the context of sex. We know with pre-implantation genetic diagnosis, you can determine the sex of the embryo. Some people later, when people want to marry and reproduce in a society, where are the girls? Right? So it raises some very important questions, right? Girls then that are not being born, there are real questions about how a society continues on, but then there are also some real questions that I've researched. If you think about this in the context of disease, there are some very compelling cases of parents who have struggled, who have diseases that are born with. Imagine that there are parents who, suffering from the economic toil and also seeing their kids struggle, might in fact say of other sons. And the book is about how poor people, poor black people in the United States migrated from the southern part of the United States to the north after slavery. And the book is very fascinating because the book tells the story about people who struggled so hard to get out of systems that were so terrible, systems where people were often brutalized, where they were underpaid, and where they were overworked. But what was fascinating about the book is that the author made clear that but for an opportunity to survive,